Dr. Kevin Kavanagh, he is a retired physician and founder of Health Watch USA. Good morning. How you doing, Dr. K?
I'm doing pretty good, Jack. Good morning.
I will tell you this, just a quick story, and you will not find it the least bit surprising. My wife and I were waiting for a table at a restaurant on Saturday morning. And we were told we could go sit at the bar area, in which we did. And we were just waiting there. We had our masks on. And a very polite woman, much younger than we are, tapped my wife on the shoulder and said, you don't have to wear that mask anymore. Now, she was polite, although nosy, she was polite. And my wife is always polite, and she thanked her. But as I said last week, and I continue to maintain, they're not going to always be friendly about it. Do you think?
Well, I think not. And as I've said, if you are high risk for other medical conditions, for example, if you've had a transplant, if you're immunosuppressed, you absolutely need to wear a mask because the vaccines may not be that effective. And a number of people have to wear masks in public places anyways, regardless of COVID. And so this is going to be, I think, very problematic. The whole idea of if you live, everything's fine, and that's going to be our bar for good public health, that's, I don't think, acceptable. Just last week, almost 40 prominent scientists from 17 countries issued a statement saying, look, we need to pay more attention to aerosolization spread of pathogens. Just like we're worried about water, we're worried about touching contamination, we really haven't been paying attention to aerosolization. And as I said a couple weeks ago, I don't want to go into a restaurant or any sort of a store, order a $5 item, come out of that store, and then be sick for a week. Cleaning up the air with air sanitization, proper air filtration is something that we need to be doing. And we need a paradigm shift, which means a huge change in how we think and view these issues. So I would hope that's one of the things that comes out of this pandemic. But not everybody agrees with the CDC that we should be relaxing the mask requirements at this time.
I think they jumped the gun on it, too. Here's what I think. Here's my 2 cents worth. That's what it's worth. I think they should have done it over a longer period of time rather than one day saying, we got to be real careful of the air because we're spreading it through the air. You better wear your mask. And the next day saying, you don't have to wear your mask anymore. It seems like we should have been stepped down some way from one to the other.
Yeah, I agree. And it's even worse than that, Jack. 2 days prior, the MMWR, which is the CDC's kind of peer-reviewed newspaper, had an excellent article in it how modeling stated that if you don't wear your masks, our cases and hospitalizations may have a surge. And so that to me is problematic. And when you combine that with the problems of the Indian variant, we're in a lot of unknown territory. And I'm going to tell you, I'm not predicting what's going to happen. It's kind of like predicting the stock market. It's just that I like to side on the side of caution. The Indian variant has now arrived in England and has a very good foothold. They feel it's more infectious than the UK variant, which, as you know, is 70% more infectious than our original variant. And so for me, I want to see what happens in England, whether or not these vaccines are truly effective. Yes, we have some laboratory evidence, but we need to know what they do in the real world. And then from there, I think you can make some decisions. The thing that was really disturbing me is that there is a mindset right now that, well, look, people aren't getting vaccinated like we want them to. That's on them. The vaccinated people are, they're okay for the wild type and the UK variant. Very unlikely they're going to get very sick from that. So the other people, it's their choice. Why close down the economy? Why limit functioning of these businesses? Well, there's a couple of reasons. One is we really don't have a good surveillance tracking system of variants for our nation. We don't have adequate genomic testing. So if the Indian variant comes into our population, it may be some time before it's detected. It could spread wildly. The other is that the people who aren't wearing masks, regardless of their political persuasion, are going to get sick. 10 to 30% are going to develop long COVID. And when that happens, we may well be straddled with long-term medical bills. And I should add, the overriding factor is that type of thinking just isn't ethical. We need to watch out for everybody in the United States. So at this point, I myself would have been a little reluctant to release all these mask mandates. I would have put it off for at least a couple of weeks to see what's happening in England and try to get people better prepared and hopefully get our surveillance system a little bit more robust in order to detect variants which may come into our nation.
Always a pleasure, sir. You have a great week, and we will talk to you again on Friday.
All right. Thank you very much, Jack.
You bet. Dr. Kevin Kavanagh. And he's a brave man because every time he comes on here, man, people just attack him.
Right.
But he is what he is and says what he believes, and I respect that. Whether you agree with him or not.